Hello, everyone, and welcome to this audio podcast. In this series, the Dezeztorm Didactic. This is an RPSG and Robotics collaborative, and it's another Storm Robotics production. And what I thought I'd do here is sort of provide an overview on works that had been collaborative between the RPSG and KDARs in England, UK, or in the UK, and where the team sort of highlight context in around an important blog that was published in the British Medical Journal, and aligned to evidence-based nursing, and the blog or the work is available through the British Medical Journal, and as an online, where there's access to sort of an online blog, their online blog. And this was works that was sort of published in September 2019, and the blog, or the works around this is and around health inequalities, poverty, and healthcare surrounding kidney care for young people. And what I thought I'd do is highlight this works. Highlight this works. So a bit of intro into this initially. So in reference to a blog that had also been published sort of retrospectively, or earlier than this particular blog, where there was a blog in the British Medical Journal, and again aligned to evidence-based nursing. There was a blog that highlighted works in reference to our children are suffering. Our children are suffering, and there in the blog there's a URL, or there's a link to actually look at the blog that had been published earlier. So in reference to our children are suffering, yes, it is crucial to highlight. We now live in a busier time. Plans and schedules have become intricate and expanded. Our energy seems to be zapped, enduring health enduring health particular or enduring health challenges. And it is also correct to highlight that the use of tech or technology, for example, where the authors have highlighted in this context, for example, smartphones, mobile health apps, internet use, and social media, for example, can all increase stress and impede negatively on well-being. However, health inequalities and poverty across the United Kingdom has increased irrespective of advances in and around tech, and it affects everyone, but especially and more so young people and the vulnerable. Health inequalities affects lives, and it is drawn mainly on lower class social groups, families, and young people. The number of young people in poverty between, for example, 1970 and 1990 was perhaps at its peak, where 1 in 4 British young people were poor, and there was a higher poverty rate. And works by where these authors have highlighted works by a citation, from Fogel, in 2010 who highlight more in around impoverishment. And during the time of when New Labour came into power, the government made a pledge to eradicate poverty. There were three outcomes to monitor. There were three outcomes to monitor, but of importance was recognizing that when family income falls, this additional negative outcomes. This has additional negative outcomes, including health inequality and social and exclusion. Um, uh, and this in effect is the outcome of for families who potentially suffer. Health inequalities and poverty encompass unemployment, poor housing, poor health and literacy skills, high crime rates, poor health conditions, and family breakdown. The authors then go on to say that the 1997 government was committed to prevent health inequalities and poverty by ensuring that it would endeavour to halve poverty by 2010 and eliminate it by 2020. Between 1998, 1999, and 2005 and 2006, 600,000 young people were lifted out of relative poverty, and 1.8 million were lifted out of absolute poverty, according to HM Treasury in 2008. Now approaching now approaching 2020. Obviously, where I'm highlighting this is from works that was published in 2020 as a blog piece, but obviously we're in 2022. But highlighting this now approaching 2020 in Britain, the current government still face health inequalities and poverty issues across young age groups. Um, and works by Hagel and team in 2018 highlight some aspects around inequalities and poverty issues and the young. Um, our children are suffering. Sort of blog that was published also in September in September uh, in September 2019 in an earlier edition of the British Medical Journal, aligned to evidence-based nursing. Also highlights that negative impacts of social media include sort of depression, anxiety, sleep deprivation, potential cyberbullying, and body image dissatisfaction, causing associations with self-beliefs, inadequacy, and low self-esteem, all of which can become detriment to overall health and well-being. However, technology use has advantages, provided used with guidance, signposting, evidence-based, and appropriate validation. Technology or tech and social media used appropriately can help or helps bridge gaps and can prompt inclusion. So, what does this all mean in context of a technology age? So, families or young people either living on the breadline seek out support when they have little or no physical support networks or feelings of social isolation, or do not have access to appropriate healthcare provider or providers, and this has been especially the case highlighted by some families and by young people in specific long-term conditions. For example, in chronic kidney disease or CKD. Now, in line with this, founded in 2014, 2014, KDARS, or the Kidney Disease and Renal Support Group, or KDARS for Kids, has supported at that time in around 2014 had supported over over a thousand patients and young families families with babies, toddlers, and young people impacted or burdened with kidney disease. Since 2014, KDARS had noticed health inequalities across the young renal or kidney population. These have increased owing to unequal distribution of environmental and economic conditions with societies which add to the isolation and loneliness of many of the families KDARS support. KDARS in the UK, the United Kingdom, learnt a lot from the works the renal patient from the works in and around the renal patient support group, the RPSG, who have done some good work to provide sort of space or basis for over at least a little while ago, where it was over 8,000 patients and carers to share experiences or lived experiences surrounding kidney care or renal care since 2009. For some young people, social media is the only support outlet for those with and living with renal or kidney disease. And KDARS has since developed a really great initiative where they highlight in this where it's been highlighted in this sort of blog piece, in this blog works, that they developed a sort of a physical space called the KDARS Pit Stop. The idea behind Pit Stop is to bridge gaps surrounding health inequalities, healthcare, and shared experiences for local families between an online space and a physical realm. The RPSG is the RPSG, or the Renal Patient Support Group, the RPSG, is evidence based, has an evidence base, and peer support through social media can and has helped young people going through the CKD or chronic kidney disease journey, and has alleviated some of that known isolation. Safeguarding and confidence is a priority, and so both the RPSG and KDARS have teams to help monitor and maintain etiquette. Young people from less privileged backgrounds can communicate with peers by way of sort of social media and through KDARS and or the RPSG. The two social media platforms have been exemplary with over sort of 15 years experience between them. And so what more could be done? Determinants of health inequalities are particularly powerful at times of transition. So, for example, ages between 12 to 24 across health and healthcare domains, and sort of healthcare policies or sort of legislation or guidance in and around health policy should factor in sort of young people and social media use. And it would be perhaps helpful if guidance and frameworks were co-developed between support groups or organizations and health professionals, those who would normally sort of physically be supporting renal patients to implement to implement, or what's been referred to here in this blog piece as professional courtesy, and help bridge gaps between health inequalities, poverty, and healthcare through social media, thus expanding sort of the care models. Now, our the works in and around the Our Children Are Suffering sort of blog also highlight some schools have started to introduce mindfulness into school curriculum. In addition, strategies to interview in the case of family or young person at risk of health inequality owing to, for example, health literacy or being subjected to inappropriate care should also be explored, and there perhaps should be a rounded educational approach envisaged in school curriculums on social media use and responsibility. So one of the reasons social media so in closing, one of the main reasons social media was invented was to help families and friends stay in touch. The ethos needs to be honed in, since depending on what social media is used, there are broader positive uses for it. And education at an early age is important, but it is also important to ensure that learning and development is part of any curriculum. Healthcare professionals should be of social media should be part of social media initiatives to understand real concerns, and help bridge issues for young people, and use correctly. Again, technology and social media is a blessing, though perhaps cliche. And finally, with great power comes great responsibility. In the blog, there are some nice there's some sort of forward reading or references or citations that or those listening in on this particular audio podcast can check out, and can check out in with this audio podcast, there will be some of the citations will be listed as well. So that draws this audio podcast to a close, to an end. And this has been an RPSG and Lobostics collaborative. This is the scientist in this audio podcast series, the Dezeztorm Didactic. This has been an audio podcast in a line to health inequalities, poverty, and healthcare surrounding kidney care for young people. And once again, this has been another Storm Robotics production. Thank you for taking the time to tune in.